Welcome to Shaping the Future. I'm Dr. Jeff Gold, and I have the honor of serving as the president of the University of Nebraska system. This video series, Shaping the Future, is about shining a spotlight on remarkable people who drive the success of our university. And through their work, they impact lives far beyond our campuses. And today, I am delighted to be joined by Dr. Mario Scalora. Dr. Scalora is the director of the University of Nebraska Public Policy Center and a professor of psychology at the University of Nebraska-Lincoln. Dr. Scalora leads groundbreaking research in threat assessment, in violence prevention, and behavioral health. He collaborates with local, state, and federal partners to create safer communities. His work reflects our mission of turning knowledge into action. Dr. Scalora, thank you for being with us today. It's really an honor to have you on this video broadcast.
The honor is
So
mine.
before we get into your job and your motivation and frankly what keeps you up at night, we'll talk a little bit about that too. Let's talk a little bit about your background and what was your career path into this amazing position that you now hold here with the university and, of course, in many other areas across the country.
Well, first of all, thank you, and the honor is mine. It is a real privilege to be part of this university. Been here 35 years, and the university has done a great deal for me, and it's a privilege to try to give back. A lot of my work, my training was initially in child psychology. Mm-hmm. And like you, worked a lot with youth, mm-hmm. and the joy and challenges with that. And what I learned was when we wanted to work with how do we help keep kids safe, we also had to look at all the array of things that put them at risk. And I needed to focus some of my energy in how do we look at those different risks and threats. And that's how I got into the threat assessment area. And when opportunity knocks, you have to answer the door,
Well, that's what I tell people all the time. If you don't answer the door, there is no chance.
Amen. Amen. And you build partnerships and you learn from everybody. And about 6 governors ago, I was working with the state patrol, and they were doing protective work for the governor, and they had a stack of files that weighed tall, and they were like, we have all these folks who harass and write threatening statements mm-hmm. toward our governor. How do we figure this out? And we were one of the first entities that did a descriptive analysis of that kind of thing, and we learned there were other people doing this thing called threat assessment. And we just decided, you know what, this is an area that could work and help a lot of people. And again, opening that door. And an array of great opportunities showed up.
Well, I'm sure it's been an amazing journey, and your work is inspirational. I'm sure our audience is going to be really excited to learn a little bit more. So let's talk about the center. In your role as the director of the center, what is the role of the center, and how do you see that moving forward?
We are a multidisciplinary center. We have a range of staff who are very talented and have different skills in terms of applying science and translating it to a range of problems across our communities. So we're doing things like community safety and threat assessment. How do we help communities reinforce good practices in dealing with very challenging situations mm-hmm. like stalking, threats in the community that may happen, whether it's to public officials or to anyone who
K-12 schools, higher education,
all
government,
the above, businesses,
the papers
everybody.
are full of it every day.
And sadly, there's been no lack of business in that regard. And we were one of the first entities that actually tied it into community policing. A lot of the early work was with the federal agencies like the mm-hmm. Secret Service. And so we started building these relationships at the state and community level with Lincoln Police, with the State Patrol. And ironically, the Capitol Police in D.C. took notice and asked if we would do that for them. And that's how that relationship started from 1999 on, where we helped build the research that built their threat assessment capability, which, knock on concrete, we have not had any mishaps related to that aspect of the process.
Well, let's talk about that, because you talked about the research, and I think what the audience may not understand is that in the world of threat assessment, you and I have talked a lot about it, is that there is research, there is algorithmic approach, there is what I would call a scientific backbone that allows you to do what you do in a systematic and reliable way. I mean, nothing is perfect in life, and I know that that's certainly true about healthcare, it's certainly true about a lot of the things we do. But talk a little bit about how that science and how that research evolved.
Appreciate that. Just like in any clinical service area, we look at the science and try to figure out how to apply it to very challenging situations. So what we did was first talk to people who deal with difficult situations and ask from different perspectives what that looked like. And that had helped inform how we would look at cases. So we did one of the largest threat assessment samples, for example, in 2003 and 2004. We looked at several thousand cases and compared the cases that went badly or challenging, either aggressive or near aggressive, to those that didn't but had a lot of concerning behavior. Because part of this is, just like at schools, not everybody who says something that is threatening is at risk. We don't want to condone the behavior, but as we know with kids, for example, people sometimes say foolish things and have to learn.
You know what? Even adults sometimes say foolish things.
I've heard that on occasion.
Yeah.
And I imagine as a university president, occasionally people share their insights with you about things ranging from football to how the university is run, and you would not be unique. Everybody,
absolutely,
every public figure gets that. And so a large part of what we're doing is trying to make sure we reassure people when we should worry versus when are the situations looking more at risk, when is the needle pointing red.
Yeah.
So that because if you overreact, you're using too much energy in addressing the non-problem situations, and then you're going to get stuck. So that's a lot of where we focus research. So we've looked at everything ranging from political threats, business threats, a lot in education, including higher education. We have one of the longest running threat assessment programs in higher ed, and we've been tracking our activity for 20 plus years so that we can see how the risk evolves and how we're doing. If we're not doing well, we're going to find out, and we need to make sure we cover up any gaps in the safety net.
So before we run out of time, I just wanted to ask you, how has that research and that science evolved over time? You said you've been at this for several decades, and regrettably, there's been no shortage of business in risk assessment over that period of time. But it just strikes me, and maybe it's just the use of social media or that I'm more acutely aware of it, but almost a day doesn't go by that there's either a threat or something that occurs in some large city, in public transportation, in a school, an athletic event, that at least is a warning, even if it doesn't turn into an adverse situation. So I'm just interested in do you think it's become more of a science and less of an art? Do you think the science and art form has changed over the years?
That's a great question. I think it's evolved together. Just like as a practitioner of medicine, you had to know how to blend the science with the situation in front of you and learn the needs of the people you're working with. I think now, 10 years ago, 15 years ago, a university president wouldn't even have to think about these things very often. And after Virginia Tech, everybody has to think about it, sadly. And we all know about Columbine and Sandy Hook and Uvalde. And we all have children, and some of us now grandchildren who we're very proud of. And we want to make sure they're safe. They're all our children. And so the awareness is up there. I think people are more paying attention, which is good. I think because of electronic communication and social media, it's easier for people to communicate and harass.
Mm-hmm.
And it's also easier for people to do hoaxes. So we have to make sure, we have constantly been aiming the microscope at making sure we're differentiating well. And we're always looking at the evolution. And what we're seeing now is that people are adding more extremist language, more justifying violence language from hate groups and different groups to reinforce their grievance and their desire to raise hate.
And they get feedback to that too.
And now they find a community. So as an example, I had a referral from an agency, a young person in one of our schools was making reference to some things from a hate group. We won't mention the group. We don't want to give them any more oxygen.
Sure.
But he was upset, talked about getting weapons and going after people. One of the things we realized was, one, we take the risk seriously, but this was also a young person crying out saying he was being alienated from his community and that other people were feeding him information that made him feel connected to them. We wanted to shift that dynamic, connect him with other people who frankly would be better influences while looking at the risk. You know, we can't put people who are that upset into a pod and put them into orbit. We don't have enough of those.
Right.
So that's a lot of what we're doing. We're trying to find dignified, humane ways to de-escalate conflict before we even have to worry about it. And we've accumulated a lot of situations where that has happened.
So one more question, because I think our audience is probably wondering, what's the threshold, if there is one, for picking up the phone or asking a question or asking for help? If you or I or somebody, one of our students or faculty, were to become aware either through social media or a social interchange with somebody, that sounds like a threat. Somebody says something either at the spur of the moment, even if there's no previous evidence or history of anything. Is there a recommendation that you make to individuals as to when it's time to call?
Yes, we keep it simple. If you have any concern, let's check it out. When in doubt, we check it out. Anything that raises concern for safety should be the threshold. We trust people's instincts. We don't have to wait for the magic threat words. So if something is bothering you, even if you're not sure to contact law enforcement, contact someone else you trust. A pastor, a colleague, your physician, your counselor, anybody who you trust, and say, hey, I'm worried here. What do you think? If you're not sure you should call public safety, call someone else you trust so at least you can talk it out.
Well, it's sort of like we say, if you see something, say something.
And say something now.
And say something now.
We know a lot of people knew they should say something but were hesitant, so we add that last phrase. See something, say something now.
Got it. Well, I think that's a good way to end our discussion today, and I just want to thank you for being with us, but I also want to thank you for all that you do. It's been a great partnership, and I look forward to the future. You should be so proud of your center and what you've done. And ladies and gentlemen, thank you so much for being with us on this special recording.